Namaskar. This is a tutorial of Chapter 5 General Principle of Anesthesia and Hair Transplantation. This chapter has been written by Dr. Sattur and Sattur in the book called Practical Guide to Hair Transplantation. This is going to be in part 3. So the challenges of anesthesia for the hair transplantation is the long hours of surgery. Hair transplant is a long hours of surgery, large area to be anesthetized, and the pain acceptance for patient of hair transplant is usually low because it's a cosmetic surgery. So the motivation is more important. You have to motivate the patient, as the motivation is when the less the pain will be more. So the local anesthesia, how the pain sensation works, the first step of pain perception is conversion of stimuli to chemical tissue event. Nociceptors are pain nerve endings in the skin. Nociceptors are pain nerve endings in the skin which along with the central nervous system and the peripheral nervous system process noxious stimuli such as tissue injury. With a noxious stimulus, these allow sodium ion to diffuse into the cells, initiating depolarization and fire action potentials which relay this information to the brain via the afferent sensory nerves leading to perception of the pain. The local anesthetic agent blocks these sodium channels and do not permit this information to be relayed to the brain, leading to no perception of the pain. The local anesthetics have a high affinity for the neural fibers that have more rapid firing rates. So the pharmacology is that the local anesthetic drugs are weak bases having the three component into it. One is a head that is lipophilic, another is a body that's a chain connecting the tail and the head consisting of either ester or amides, and a hydrophilic tail. So more the lipid solubility, more is the potency, and more the protein binding capacity, longer the duration of action. Like bupivacaine has more potency and longer duration of action, as it has more potency, it has more lipid solubility and more protein binding capacity, so it has a more potency in comparison to lidocaine. The local anesthetic drug may be classified into two groups. One is the amides like the lignocaine, bupivacaine, ropivacaine and prilocaine. Esters, these are like cocaine, procaine and the tetracaine. Amides anesthetics can be administered to patient having ester as anesthetic allergy. The mechanism of action, the ability of the local anesthetic to reversibly block the sodium channel in excitable state, thereby preventing the action potential propagation in the axon which is responsible for anesthetic action. Like this is the axons neurolema are there. Here is that the sodium channel, and these local anesthetic, this blocks the sodium entry, so depolarization of the cell is prevented, and that's the mechanism, so the nerve pain stimuli are not propagated. This section is also responsible for the toxicity of the local anesthetic agent. Both structures are being rich and fast in fast sodium channel. Lignocaine is an intermediate acting local anesthetic agent. It's a amide type indicated for local or the regional anesthesia in the treatment of ventricular tachycardia. Pain lidocaine means without epinephrine, acts within 1 to 5 minutes and lasts for 30 to 60 minutes, and when used with the epinephrine the action can be prolonged up to 2 hours. The maximum dose means total daily dose for the local infiltration is 300 milligram, means the 4.5 milligram per kg body weight. When it is combined with the epinephrine, then 7 milligram per day, means around 500 milligram. So combining lidocaine with bupivacaine is possible if required use of neuroprotective medication like benzodiazepines and all that. They help in optimum effect and the optimum dosing. The lignocaine commonly available commercial preparation is a plain 2% solution which has got 21.3 milligrams of lignocaine hydrochloride with additive sodium chloride and a preservative, that is methyl carbamate, that is a methyl paraben. The 1% solution contains 10.7 milligram of lignocaine per ml. It is also available in combination with adrenaline or epinephrine, where in addition to the lignocaine, it contains adrenaline in concentration of 1 is to 200,000. A preservative-free lignocaine preparation is also available, which can be used for intravenous administration in the cardiac patient. Bupivacaine, the onset of action is slower, means due to lower dissociation constant of than the lignocaine, but has a higher potency and a longer duration of action. It is available in two strengths, 0.25% and 0.5%. The maximum dose is 175 or the 3 to 4 milligram per kg per day. The use of bupivacaine is limited because of its potential cardiac toxicity. The bupivacaine produces a significantly greater depression of left ventricular pressure than ropivacaine, mopivacaine, and lidocaine. Though these effects are rare with the safe doses, but nevertheless there is a potential of catastrophic events to occur. The ropivacaine is an amino-amide local anesthetic, a long-acting anesthetic agent which has less cardiotoxic than the bupivacaine. When used in lower concentration, ropivacaine is less potent than the bupivacaine, but when used in concentration of 0.5 or higher, it produces a significant blockage through the duration of action, though the duration of action is slightly less than the bupivacaine. Higher concentration 0.75 acts faster but with reduced toxic effect as compared to bupivacaine. Various clinical trials have evaluated the safety of the ropivacaine. Let's understand safe dose lidocaine 4 milligram per kg per day, lidocaine with epinephrine is 7 milligram per kg per day, bupivacaine is 2 to 3 milligram per kg, ropivacaine is also 2 to 3 milligram per kg. 1% of any drug has a 10 milligram per ml is the dose. Lidocaine usually comes 2%, so for an average of 70 kg weight, if we do it into 4, 70 to 4, it will be equivalent to 280 milligram, means 14 ml of 2% or 28 ml of 1% lidocaine can be used. With epinephrine, the dose will be 490 total in one day for a 70 kg of a patient. Now, levobupivacaine, yet another safer alternative to the bupivacaine for regional anesthesia. Not only does it have a better pharmacokinetic profile, but also it has a less affinity and depressive effects on the myocardium and the CNS. Levobupivacaine is well tolerated and is extensively metabolized with no drug detected in the urine and the feces. Levobupivacaine is a safer alternative to bupivacaine. Articaine is an intermediate potency, short acting amide local anesthetic with the fast metabolism. Though there is no statistical difference in aesthetic efficacy of articaine 4% and lidocaine 2%, articaine is thought to offer better clinical performance. Now we come to the anesthesia in the hair transplant. A detailed history and physical examination in office setting will highlight comorbidities that could need medical evaluation preoperatively, like hypertension, mild to moderate cardiac disease, diabetes mellitus, drug allergy, epilepsy, so and so on. A medical history form is helpful in screening the medical condition that impact the eligibility of the patient for the hair transplantation. Sometimes we forget to take the history, so a Medical history forum is always better so you don't miss any point. The red flags means these are the risk factor are the comorbidities that may impact the procedure are hypertension, diabetes mellitus, coronary artery disease, patient on aspirin, clopidogrel and the other anticoagulant, and a patient on epilepsy for a patient of epilepsy or those who are taking anti-epileptic drugs and non-selective beta blocker like if a patient complains of chest pain, nausea, weakness, breathlessness, it is better to think about transferring the patient for the further treatment to a cardiac center. Coagulation profile, bleeding disorder, a proper assessment of coagulation profile in a patient who have not undergone any surgical treatment before is a good option. Any patient who is very anxious, having too much of anxiety, restless, such patient also has got a high risk of going vasovagal or other problem. The smokers has a high risk of necrosis, so it is advisable to stop smoking 2 weeks before. Patient should be screened for the immunodeficiency problem or disease like HIV, Ashley antigen, so he should be investigated for this. Preoperative preparation, sedation, adequate preparation, preoperative sedation to reduce anxiety is advisable. Raise pain threshold in a patient who has got more anxious and sensitive. It is good to give them sedation. Algopram of 0.05 milligram helps you if it is given preoperatively. Many hair transplant surgeon uses systemic agent like I use mijolam IV and also sometimes we use algoprolam tablet. Agents commonly used are the benzodiazepines like the diazepam or midazolam, propofol, fentanyl, opioids, ketamine. All these should be used ideally in the presence of anesthetist, or it is better if you don't have it is better to avoid any IV sedatives or anesthetic agent. It is important point to remember this IV sedation should only be when you are using this, you should have a well equipped operative room. You should have all the parameters which manages the vital parameters and intubation instrument, oxygen, etc. The techniques to reduce the pain of injection is also important for the such patient. Most of the pain is associated with the hair transplant during the injection of the local anesthetic. It is also the time when there is an increased incidence of vasovagal episode due to the pain of the injection in susceptible patient. The pain of injection is primarily due to increase in tissue pressure due to increased volume of anesthetic solution injected. The pain is directly proportional to the speed of injection. So rapid injection causes more pain. So contributory factors are the temperature and the pH difference between the injected fluids and the local tissue. Also the depth of injection has a bearing on the amount of pain. The pain is much less when it is injected in subcutaneous tissue as compared to superficial injection into the like this is a vibrator I use. It is highly effective. Nowadays the cold vibrator is also there which has been innovated by Dr. Kuldeep Saxena. This is a dermajet needle less syringe. I use this also, and this is a cold pack gel. Now the epinephrine. So let's understand epinephrine in detail. This is very important. You must know each and everything about the epinephrine or it is a vasoconstrictor used for hemostasis, gives prolonged effect of drug by slowing down the absorption of the drug. It comes into 1 is to 1000 concentration of 1 ml vial in an amber colored vial. This has a 1 milligram of epinephrine salt equivalent to 1000 microgram. That's why it is written as 1 is to 1000. The vasoconstrictive dose is 2.5 to 5 microgram per kg body weight. The maximum of 5 microgram per kg causes effective vasoconstriction without systemic side effect like tachycardia and the hypertension. So you can say that if a cardiac patient or something, then 5 microgram is a per kg is a safe. Epinephrine is found that subcutaneous infiltration using 1 into 100,000 solution causes significantly more tachycardia than 1 into 200,000 solution, and 1 into 500,000 solution is virtually free of any side effect but will still produce a significant decrease in bleeding. Therefore, higher dilutions are recommended while using tumescent anesthesia. It is important to deliver adrenaline to right area, especially in the subcutaneous layer where the larger blood vessels are present, to get optimum benefits. In hair transplant surgery, it is used in the nerve block for the infiltration and is a part of tumescent solution. The cautions with adrenaline in hypertension surgery. Adrenaline in local anesthesia is like a double-edged sword. It has both advantage and the disadvantage. As a as scalp is vascular, it is necessary to reduce bleeding in hair transplant surgery and prolong the action of lidocaine. But if not used judiciously, it can increase the risk of localized vascular compromise or the risk of systemic side effects like tachycardia, particularly in those with history of cardiac problems, as clinical trials have confirmed unequivocally that even small doses of epinephrine in a local anesthetic solution have an influence on the cardiac function. Patient with cardiac stable cardiac disease can be administered local anesthesia with the adrenaline, but it is better to get clearance from the cardiologist. Factors hasten the onset of local anesthetic drugs like the soda bicarb increases the pH, which increases the penetration of local anesthetic and which fastens the action of local. Important to remember that when mixing different local anesthetic agents, that these agents follow principle of summation, so the dosage becomes additive. For example, if you had administered half the maximum dose of lidocaine and wish to add bupivacaine, then reduce maximum dose by half. So there is an addition, means the summation effect is there. Local anesthetic causes depression of CNS, and it is important to remember that they can potentiate respiratory depression caused by sedative or the asthma. Yes, generally well tolerated as well controlled asthma should not pose a problem, but use of sulfite containing drugs used in some preparation of lidocaine with epinephrine can cause allergic reaction in these individuals. Antioxidant used in local anesthetic solutions like sodium metabisulfite may induce allergic or asthmatic attacks. Also, patients with controlled asthma who have not been exposed to local anesthetic, as well as the patient with history of multiple drug hypersensitivity reactions, should undergo a local anesthetic sensitivity test. Antipsychotic drugs. Local anesthetics with adrenaline, when used with phenothiazines like chlorpromazine or risperidone, can cause fluctuation in blood pressure. In some countries like Japan, it is contraindicated to use the local anesthetic with adrenaline in a patient receive antipsychotic medication for the fear of causing hypotension. Now the tips for the safe injection of local anesthetic. It is safe to use local anesthetic agent with or without adrenaline in most patients and even in those patients with medical illness. Simple guidelines, if followed, can make the entire process more safe. It is important to make a habit of aspirating before injecting to rule out intravascular deposition of the anesthetic. The anesthetic should be injected slowly. It is important to watch the patient during and after the injection for any untoward sign. Choose the local anesthetic with or without epinephrine thoroughly. Choose the local anesthetics, okay, thoughtfully. Means choose the local anesthetic thoughtfully. Keep in mind to use the least amount of dose required in achieving the satisfactory anesthesia.